Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Are you tired and finding it difficult to lose weight? Dr. Tenenbaum, author of Thyroid Secrets for Youthful Energy and Metabolism, explains how adding and adjusting thyroid medications can revitalize your energy and metabolism. Thyroid Secrets can be found on Amazon.com or through his office by calling 805-214-9990. Hello, welcome. And today we have Dr. Steven Tenenbaum from California joining us today. Thank you for joining us.
Thank you for having me.
So, let's find out first who you are. Could you tell us your history to date?
Sure, I can give you a little bit of information about myself. So my name's Steve Tenenbaum. I live in Southern California, Thousand Oaks, which is a northern suburb of Los Angeles. And this is actually the area that I grew up in, but it's nice to come back home. It's a beautiful area. But I basically went to high school here in Thousand Oaks, and then I went to college in UC Santa Barbara. And then I had a couple years off where I got to travel around the world, do some different things, teach ballroom dance. And then I got into medical school at Penn State, which is in this middle of Pennsylvania. So there I went to medical school, and then afterwards I did a general practitioner training in Tucson, Arizona, and then I started working. And this is where it gets relevant to, I guess, LDN and anything that's alternative. I was working in an emergency room I'll take a step back. Always in medical school, I was always a little bit skeptical of standard medicine. I'm skeptical of natural medicine, skeptical of standard medicine, because we know that things are always evolving, so you don't want to stay put too much in or be set in one's ways. So I had always studied like alternative medicine in the evenings after regular medicine was done, basically after 9 p.m. So I always had an inkling that, hey, there's got to be something different. Well, when I was working in Ohio, I was working in the emergency room, and there was a nurse there who said, hey, I know you're into alternative things. You have to go meet this doctor who was like 30 minutes outside of the town that I was in. And she said, he saved my life, which is very unusual for a nurse to say. So I said, well, how did he save your life? Because we're working in the ER where you sometimes do save someone's life. And she said, no, she was suffering from fatigue and depression and chronic fibromyalgia. And he basically knew what to do. So I went to go meet him, and that was really my best introduction into alternative medicine and practicing medicine. And that was a fantastic doctor who was the head of ACAM at the time, and he taught me a lot. I was also very lucky that the year when I was doing my internship in Tucson, that's where Andrew Weil has his clinic at the University of Arizona. So I did a rotation with him, which was fantastic. So I got to meet a lot of interesting people. And then, of course, whenever you learn things, you just accumulate knowledge. And the most important thing is to accumulate experience where you end up learning by treating patients and getting some feedback. So that's kind of a brief summary of my background. That doesn't tell you much. And I can tell you a little bit, if you want to hear right now, I can tell you a little bit about what I'm doing currently.
Yes, please.
Okay, so currently, I have a private practice, and it's me, and then I have 2 nurse practitioners and a physician's assistant. I don't know if you have the same thing in the UK, but these are lower-level providers who are fantastic. I train them, and they're extensions of me. But in my practice, I wrote this thyroid book, Thyroid Secrets, and so I see a lot of people for thyroid problems. I do thyroid ultrasounds, biopsies, treat cancers, thyroid cancers, and lots of Hashimoto's, lots of Graves' disease. So a lot of my experience with LDN has come with treating patients for the autoimmune component of this. So patients who have autoimmune thyroiditis, most people have Hashimoto's, and then a smaller percentage of patients have Graves' disease. And I found it really, really useful because we don't, obviously suppressing someone's immune system is not great, but LDN seems to be the beautiful match of being healthy for the patient and modulating their immune system. So I've been very pleased with it. In addition to other things, no doctor only gives one treatment. Every doctor does a combination of things.
Exactly. So how long ago was it when you first heard about LDN? What year was that?
It's probably been 10, 12 years I've been using LDN, maybe even longer, maybe closer to 15 years. And I don't know exactly how I learned about LDN. It may have been either through a conference or through one of the first jobs that I was working. I worked with Dr. Holtorf, Kent Holtorf. I don't know if you've met him or interviewed him before. He's a fantastic doctor.
He's actually one of our medical advisors.
Oh, he's fantastic. So I don't know if it was when I worked at his office. I worked at his office for 3 years, or whether it was at a conference. And I know at his office, we even like to use the ultra low dose naltrexone for people who are using opioids, which seem to reduce their dependence on opioids, which was excellent. But for immune modification, I've been, like I'm saying, it's probably been 12 to 15 years. And what's fun is, let's say it's such an objective thing. So if I take a patient and I check their antibodies for Hashimoto's, that's the TPO, thyroid peroxidase antibodies, and normally it's supposed to be, let's say, less than 20. And many patients who have Hashimoto's, you're familiar with, I know you know about all these things, but Hashimoto's is an autoimmune attack of the thyroid gland that damages the thyroid over time. So thank God it's the thyroid and not someone's eyeball or someone's face, because it would be very disfiguring. And when you do ultrasounds of someone's thyroid, there's a huge variation. Some people just have a touch of damage to their thyroid, and some patients have a completely destroyed thyroid. That's why I love doing the ultrasounds. It can tell me, is there something worth saving, for example. Anyway, so let's say I check someone's antibodies, and their antibodies are very high, like 1,500. And then I put them on a regimen. Let's say I'm treating them with thyroid medicine, and then I'll give them LDN, and then I'll ramp them up from the traditional way, like 1.5 for a month and 3 to 4.5. And then maybe when I'm done, you can give me some advice if you guys are changing the way, if the other practitioners are changing the way they do that. And then over time, I usually give them some selenium, some things to help chelate heavy metals. And then I just track their antibodies over time. I usually wait like 3 months to check. And it's really pleasant to see over time their antibodies get better. The antibodies drop. And then usually after a few years, you hope they come down. Let's say they were 1,500. They'll usually come down to the hundreds. But there's always going to be a certain percentage of the patients where the antibodies come back down to completely normal, which is even surprising to me. So that's my typical, that's where I use it most, LDN with Hashimoto's, to preserve the patient's thyroid. I'll just say one corollary. Please go ahead.
I was just wondering, when the antibodies drop, the damage that's been done to the thyroid, because I'm not a doctor, does that remain the same? Can it repair itself a little bit, or is it once the damage is done, it's irreparable?
Yeah, so that is a good question. So let's say what I will typically do when I do an ultrasound of someone's thyroid, and let's say the thyroid is 40, by the time they're seeing me, let's say it's 40% damage. So that's just an example.
Yeah.
So, and you can see that, you'll see it scarring on the thyroid. In fact, by the time someone's TSH is elevated, you have to think to yourself, probably at least 50% of the thyroid's damaged, if not more, because now the TSH is elevated. So that 10%, 20%, 30% damage, it's already been damaged. It's probably at least 50% damage by the time the TSH starts going up. So what I usually tell the patients, we'll look at the screen together and we say, hey, you see those areas of dark? That means the thyroid tissue has been damaged. It's scarred down. And I say, just like acne scars, if I came to you and you were my dermatologist and I had acne scars and fresh pimples, and you're the dermatologist, you would say, hey, I can get rid of those. All those fresh pimples that you got, I'm going to get rid of them, but the scars are the scars. And it's the same thing with the thyroid. I have not seen the thyroid totally not seen it regenerate itself. What I have seen is that you can preserve whatever thyroid tissue they have left instead of watching it get more and more damaged. Now, that's where I was going to say it's very relevant, because let's say I see a patient and they have their Hashimoto's positive, but when I do the ultrasound, their thyroid looks very good, like meaning there's still a lot of thyroid tissue left. Then that's someone who I'm going to much more vigorously treat, that I want to get their antibodies down as naturally as possible. For a patient who wants to cure their Hashimoto's, but they come in and their thyroid's 95% damaged, it's kind of like, okay, it's nice to get rid of that inflammation, because no one needs inflammation, but no one's going to bring back that thyroid until we're good enough with stem cells that you could just put some stem cell in there. And that's not something I have expertise at right now. Mm-hmm. So yeah, what's done is done, and the thyroid is not like the liver. It doesn't like to come back from damage. Now, I have to say an experience I have with Graves' disease, where Graves' disease remembers this, I know you know, but Graves' disease is where you have the antibodies attached to the thyroid, and then instead of, some of the antibodies will destroy the thyroid, and some of the antibodies will actually stimulate the thyroid, so people are hyperthyroid. So with the hyperthyroidism, this has been the most surprising thing to me, is that if I treat them aggressively with natural things, maybe get them things off an anti-inflammatory diet, maybe get rid of their gluten, I give them a chlorella, and I give them selenium, and then I have them take the LDN. And I see some of these patients with the Graves' disease, which they have way too much blood flow to their thyroid, and their thyroid looks lousy. I have seen some of those patients where I see their thyroid after the fact, and their thyroid looks 100% normal. I probably have 10 patients in my practice where they're not only it usually takes 6 months to 2 years, but they went from completely hyperthyroid Graves' disease with a not well appearing thyroid on ultrasound to 2 years later where it looks like nothing happened. So that's not happened once or twice now. It's happened probably 10 times. And most of my patients, even with the LDN, I have not had to do radioactive iodine on any of my patients following this, or surgically cut out anyone's thyroid with this kind of combination. It's worked very good. The one thing I would say about hyperthyroidism is when the patient comes in, I say, oh my gosh, you have hyperthyroidism. This is horrible, meaning not horrible. I said, this is not going to kill you, but it's going to annoy you to death, because when someone has hyperthyroidism, you're making conts every 2-3 weeks for probably the first 6 months. You're making adjustments to their medicines. You're giving them the natural things. You have to treat them temporarily with medicine to control things. And then over time, as their immune system kind of modulates itself, then I start taking away the medicine like propofol, uracil, or and then they can kind of go back to a little bit more natural state. So anyway, that's been my experience with some thyroid.
Mm-hmm. And are you prescribing it for other autoimmune conditions?
So yes, but since I probably say about 40% of patients who see me are for thyroid problems, so I have lots of experience with thyroid. But yeah, I prescribe it. People will come in and they have multiple sclerosis and they want it, rheumatoid arthritis, lupus, any autoimmune disease. I'll prescribe it for, because it's safe. And there's doctors, when you go to one of these, when I go to some of the conferences and you have a certain percentage of the doctors taking it for health reasons, they're not treating any disease. They're just taking it for anti-aging reasons or immune system modification reasons, or the interesting stuff on naltrexone, even bumping up men's testosterone, which if you give a guy opioids, that decreases the testosterone. If you give a little bit of naltrexone, it actually bumps up their testosterone. So what I usually tell my patients is, hey, this is not going to hurt them. This is safe, and they have nothing to lose by trying it. Like all things, if you give, how many patients do I have with MS? So I probably have 4. So that's not a good enough number to be like, oh my gosh, it's amazing, because that's just not enough patients. So that's when I have to look at, the research to say, hey, this seems like reasonable. With hypothyroidism, I probably have 1,000 patients with hypothyroidism, and I probably had 100 patients with Graves' disease. So that's enough to actually have personal experience where you say, oh my gosh, I think this has been really helpful in addition to the other things that we're doing. So that's been some of my experience.
Mm-hmm. So for all the patients that you've had on LDN, has anybody reported any negative side effects?
Not really. I think, remember like 12 years ago, we used to tell someone that they had to, I don't know what the research was, that we thought it had to be given at bedtime. And sometimes some patients, it would affect their sleep a little bit. And then it seems that everyone's more, I'd like to ask your opinion on that. It seems like people are more flexible about the time that LDN can be given. So the patients who have trouble, I usually recommend they take it at bedtime. And if they have trouble with it at bedtime, then I just tell them to take it during the day. But no, I've never had anyone stop LDN because it's like, oh my gosh, the side effects are bad. Some patients, we just need to lower the dose. May I ask you, because you're, I'm sure, more up to date with these things. What is the recommendations for time of day? Well,
it exactly what you said. Take it at night if you can tolerate it. I know many, many doctors who will say to their patients, if you have difficulty sleeping, take it during the day, and they find they have equally good results with taking it in the morning, which is quite interesting.
Do you know what the theory was? Why it has to be given why it was originally given in the evening?
Was that the body makes more endorphins at night than it does during the day?
Oh, and that modulating that at night you're going to have a better, or you're going to have more modulation by doing that.
Yes,
that's interesting.
Yes.
Yeah, it's interesting because a lot of the things we think may be true are not true, right?
Yeah, exactly. Well, I don't know whether you make more endorphins during the night than you do during the day, but I do know there are many people and patients who say they prefer taking it in the day. They find it gives them more energy. I've tried both and I haven't noticed anything.
Oh, interesting. So may I ask you, of the people who can follow what you do, what is the most common diagnosis that people are taking LDN for in your experience?
Okay, when we first started, I started the LDN Research Trust in 2004. The majority of people then were taking it for MS. Now it has pain conditions, I would say, rheumatoid arthritis, fibromyalgia, also ME, CFS, Crohn's disease, ulcerative colitis. All of those conditions, I would say, would equal now MS. I think MS is just one of the many conditions, not the condition that LDN is used for. And it's also used in mental health conditions as well. Traumatic stress, anxiety, depression. It's quite an amazing drug. It really is quite amazing. We have three psychologists speaking at the conference this year in their experience of LDN. And the timing and the dosing is slightly different as well. So that's something that we can learn from. But this is the thing with LDN. There is always somebody doing some trial or study themselves, and we can learn all the time new different ideas, like the ultra low dose. And some doctors also prescribe higher than 4.5. They find, their patients, as they'd increase from 3 up to 4.5, had better benefits, but then they plateaued and didn't seem to move on any further, and then they'll perhaps increase it to 6 and find that all of a sudden, once they got to a slightly higher dose, that the patient did a lot better.
Right. And each each one of us has a different patient population too. So what we're going to have experience with is a little bit unique. I myself have been surprised, just like that nurse who told me that how that patient, the nurse said that doctor saved her life, who had the chronic fatigue fibromyalgia. If someone told me, 15 years ago that you could take someone with Graves' disease and reverse their autoimmune condition and have no ramifications thereafter. And then now on some of my patients, it's been years since they've had the Graves and their thyroid looks beautiful and they're not even taking any thyroid medicine. I would say that's nearly impossible. But after that happens, even in your own experience multiple times, you're like, wow, this is amazing. It is amazing to be able to do that. And like anything, whenever you treat a patient, you're going to have some fantastic responders. Like I have some patients with rheumatoid arthritis who have given LDN and they're fantastic responders. Their pain gets better. Their swelling goes away. And then there's other patients, of course, who have lackluster. And then there's a bunch of patients in between where that needs to be part of a comprehensive plan, not alone. Mm-hmm. So I've seen you experience the same thing amongst the LDN community.
It always seems to me a ridiculously high number, but the majority of people do notice benefits on LDN, and it is usually quite high. I mean, the doctors who I've interviewed say around about the 80% mark. Some even say higher, that, their patients respond really well. But LDN is still a drug, and we know that drugs don't always work for everybody. So,
right. Nor do natural things work for everybody either. Mm-hmm. Melatonin doesn't make everybody sleep, unfortunately. L-tyrosine doesn't work as a stimulant for everybody. Ashwagandha doesn't work for everybody. So, if in your experience is 80%, that's pretty good. I've since I'm a pragmatist as a doctor, I've learned that in theory, sometimes you'll learn about something, and in theory, you're like, okay, that should work on everybody, but that's not the way things work in real life. You could give someone diphenhydramine, Benadryl, and you're going to have 80% of the population it's going to make them sleepy, and you'll probably have 10% of the population where it makes them hyper, which makes no sense, and where they can't sleep at all, and another 10% who gets weird on it. So it is amazing. Something that has the same effect, like such a consistent effect, is not going to have the same effect on everybody. Each one of us is so unique, exactly. Which is fun and also super frustrating.
Mm. And I've heard some absolutely remarkable stories where, just very briefly, we're going to run out of time soon, but a lady was going to, she'd got Crohn's disease, she was going to have a bowel removed. She'd panicked and discharged herself, found LDN. When she went back, like a year later, because she was going to die. If you don't have the operation, you're going to die. You're bleeding so much, you're killing yourself. She went back. They had no signs of Crohn's at all. It had gone, which I thought was amazing. Right. There are people who have MS who the MRI scans show they've got all these lesions in the brain. They go back after a period of time on LDN and the lesions are gone. I don't know whether lesions are like scarring, as you were saying, on the thyroid, how the lesions can go. But anyway, these people tell me they go. And people with cancer who have had, only a few months to live, start on LDN. And not only do they go into remission later down the line, they can't find the cancer, and then they question, did this person actually have cancer? And we'll have to go back and check everything. Right. Just absolutely amazing. But like we said, for people that are listening, it doesn't happen for everybody. So, and also because it's
at the same time, right. There's a risk benefit to things. Just as a doctor, my take on LDN, I'll have some patients who I must be on a list of LDN providers or something from different pharmacies, because I'll have periodically patients come in specifically and they say, hey, I know that you prescribe LDN. Can you prescribe LDN for this reason? That is the most simple, non-threatening visit ever, of course, meaning that means they've already done the research. They know that it's can be useful for their condition, and it's such an easy thing to prescribe. it's not complicated, and it's not going to give them side effects. It's safe. It's not expensive. It's a great tool. And if it works for them, that's fantastic. So I would say to any of the people who are listening who are on the fence, most people don't need a whole lot of convincing, right? Once they read information on LDN, I would just say from my clinical experience, this is not like a scary thing to try. It's not like, and for the most patients who are looking at LDN have, particularly for immune system problems, have been on steroids or been on something that's just horrible. I had a patient who has myasthenia gravis. So myasthenia gravis is where you have antibodies that attack the acetylcholine receptors, and then you end up having weakness. And the doctor, their neurologist / rheumatologist, basically put them on a steroids for like 2 years, which I could not believe, which is so bad for your body. These are catabolic steroids like prednisone. And so when I saw him, I'm like, why don't you take LDN and like DHEA and now you're taking steroids, anabolic steroids, you should take something, catabolic steroids, you should take something anabolic at the same time. Meaning sometimes you get the university professors who are not familiar with research and end up giving really harmful things when they could take something that's actually beneficial to them. So that could be a source of frustration. So I'm glad that you're getting the word out and patients know. I would just say from my clinical standpoint, I know at least for thyroid autoimmune disease, I've been extremely satisfied, and for patients to realize that, boy, it's not a big deal to take LDN. This is not a dangerous medicine to take. It's really not a big deal compared to almost everything else we have.
Well, we've just got 30 seconds left. So very quickly, how long do you think it takes a patient to notice that LDN is working?
Okay, so this is where it's highly variable, and I have to tell you, I'm not so sure myself. So when it comes to autoimmune disease, like with a thyroid, I'm treating them with thyroid medicine anyway. So let's say they're hypothyroid, and then they come in, I put them on a gluten-free diet, give them LDN, and give them thyroid medicine. Well, my patients are going to feel better probably within a week because I'm giving them thyroid medicine. But when I see the antibodies move down and you're getting rid of some of the inflammation, that's going to take longer. So that I would tell a patient, hey, don't expect something. I would be patient for like a month to 3 months if I'm giving them LDN. Now, with regards, that's the same thing with Graves' disease. I'm telling them that that's going to take time. When it comes to rheumatoid arthritis, though, I've had patients, or even Crohn's disease, I've had patients who get better faster, that even within a few weeks they notice something. But since the amount of patients I have with those individual conditions is less, it's hard to say because placebo is going to work on 30 to 40% of patients anyway. So sometimes if someone tells me the next day that they're better, then I'm like, I wonder if they're really better or if that's placebo. Now, one last thing I was going to say is I have a patient who had rheumatoid arthritis with swollen joints, and they started the LDN, and within a couple of days, their swollen joints went away, and that's something that's really hard to say is a placebo because placebo is not going to make someone's joints unswell. So I've been pleased with it. It's been a great tool in a doctor's bag to have.
Okay. Well, thank you very much. It's been our pleasure to speak with you today.
Oh, thank you for having me. You take care. Have a wonderful day.
Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well. Are you tired and finding it difficult to lose weight? Dr. Tenenbaum, author of Thyroid Secrets for youthful energy and metabolism, explains how adding and adjusting thyroid medications can revitalize your energy and metabolism. Thyroid Secrets can be found on Amazon.com or through his office by calling 805 214 9990.